Ebola by Cameron Frost. Ebola hemorrhagic fever, or more commonly known as Ebola, is an African disease originating in the Democratic Republic of Congo in 1976. The Ebola pathogen, Ebola virus, is a member of the filoviridae virus family along with the Marburg virus. Together they are commonly known as filoviruses. The Ebola virus is a virulent pathogen that causes fatal hemorrhagic fever in humans and non-human primates. Ebola gets its name from the Ebola River. Symptoms may appear anywhere from 2 to 21 days after contact with the virus, with an average of 8 to 10 days. The course of the illness typically progresses from dry symptoms initially and then progresses to wet symptoms as the infected person becomes sicker. Symptoms include fever, fatigue, severe headaches, muscle and joint pains, abdominal pains, weakness, unexplained hemorrhaging, bleeding or bruising, red eyes, skin rash, diarrhea, vomiting and hiccups, which is a later stage. As the virus spreads through the body, it damages the immune system and organs. Ultimately, it causes levels of blood clotting cells to drop. This leads to severe, uncontrollable bleeding in and outside of the body. Ebola is thought to be a zoonotic virus. Fruit bats are considered natural Ebola virus hosts. Ebola enters the human population through contact with blood, secretions, organs or other bodily fluids from infected animals like monkeys, chimpanzees, fruit bats, gorillas, and baboons. Human bodily fluids may carry the virus: tears, saliva, semen, sweat, mucus, urine, and feces. The entry points on the body include mouth, nose, eyes, open wounds, cuts, and abrasion. The virus can also be transmitted through contact with surfaces and objects contaminated with the virus. With the many strains of the Ebola virus disease, eradicating it would not be easy. There are 6 known strains of the Ebola virus, including the most common and deadly, the Zaire Ebola virus. The others are the Sudan Ebola virus, Tai Forest Ebola virus, Bundibugyo Ebola virus, Reston Ebola virus, and the Bombali Ebola virus. The World Health Organization said there is no proven treatment for Ebola, but simple interventions early on can significantly improve chances of survival. This includes rehydration with fluids and body salts, and treatment of specific symptoms such as low blood pressure, vomiting, diarrhea, and infections. In 2015, a trial vaccine called RVSV-ZEBOV, sold as Ervebo, was tested in Guinea, which proved highly protective against the deadly virus. The vaccination is a one-time only and was used as a ring vaccination. Ervebo is a recombinant, replication-competent vaccine consisting of a vesicular stomatitis virus modified to express a glycoprotein, which catalyzes a neutralizing immune response to Ebola virus. The people vaccinated were observed for 30 minutes at in-home visits on day 3, 14, 21, 42, 63, and 84, in which headaches, fatigue, and muscle pain were extremely common, which coincidentally are all Ebola virus symptoms. The Ebola virus is extremely infectious, so health workers assisting Ebola virus patients must be very careful when treating them. The doctors and nurses must wear 2 layers of gloves, a liquid improvised surgical gown and boots, hair covering, mask, and face shield. Changing and getting rid of biohazard suits is also done by the medical professionals when treating Ebola patients. Since 99.98% of the confirmed cases are from Africa, considering the poverty, there are not really many social strategies other than don't go near people who are displaying the numerous amount of symptoms. Other countries outside of Africa had little but effective social management strategies, like closing the borders to their country from most African countries. The first reported case of an Ebola virus in humans was in the Democratic Republic of Congo in 1976, and has since had 9 more outbreaks of the virus, 1,000 cases, 800 deaths at a fatality rate of 80%. The other countries with the most outbreaks are Gabon with 5 outbreaks, 210 cases, 150 deaths at a fatality rate of 72%, Uganda with 5 outbreaks, 600 cases, 280 deaths at a fatality rate of 47%, and the Republic of Congo with 4 outbreaks, 250 cases, 211 deaths at a fatality rate of 84%. The worst outbreaks were in 2014-16 in Guinea, Liberia, and Sierra Leone. Guinea had 3,800 cases, 2,500 deaths at a fatality rate of 67%. Liberia had 10,700 cases, 4,800 deaths at a fatality rate of 45%, and Sierra Leone had 14,100 cases, 4,000 deaths at a fatality rate of 28%. Thanks for watching.